India has a nutrition problem. One end of malnutrition, the other end of obesity. Prime Minister Narendra Modi pointed out this problem recently. I have with me Dr. M. Srinivasan. He is the director of the All India Institute of Medical Sciences in New Delhi, a very heavy and a very weighty voice for public health. Thanks a lot for speaking to us, Dr. Srinivas. You rarely speak. How big is the problem on both ends?
See, we are going through difficulties with respect to nutrition in the country. On one side, we have conquered the infectious diseases, but malnutrition is still a problem, especially in children and in the rural areas. So that is also a diet issue, is a malnutrition. That is lesser amount of calories and proteins and other things. On the other side, even in the rural areas now, paradoxically, that we are having more of the obesity issues, and the obesity going by the body mass index of 23 or the definitions, more and more of our, not only the urban but also the rural area is getting into this problem. So the biggest challenge with obesity is that, it has risk factor for everything. The most common thing which we understand is the coronary artery disease on the heart, but most of the organs, including the cancers, are something to do with the obesity and the diet we take and the oils we consume. They all have that. See, the most important thing, if we are asking at the prevention of obesity, somebody can measure it, if it is 80 centimeter or 90 centimeters on this, there's an obesity depending upon the sex of the person. And the problem is, it's not the obesity with respect to the BMI going by the definitions, but we have a peculiar obesity in India that, we have the obesity which happens on the abdomen.
The pear shape.
Yeah. The abdominal obesity is the thing which is very dangerous. And we may be normal with the BMI, my height and weight and the BMI may be normal, but if I put on the fat on the abdominal side, abdominal obesity is something which has become a significant risk factor for all the diseases.
How do we control it?
The biggest thing is, of course, the lifestyle modifications, the diet changes, exercises and all that. But the most important thing, as you brought the Honorable Prime Minister into the picture, it is the oil, which is one of the biggest things and the most important thing which we need to look into that.
Which is edible oils.
Yes.
Let's clarify.
Oils. Let us look into the calories. It depends upon the weight and height of the person, the sex and the kind of work they are doing it. There's a different range of calories. But when it comes to percentage, we need to have balance of the things. 15% of the diet should be something like protein, 30% or less than 30% is a fat, and the rest of 55% will be carbohydrates. Now the focus is on proteins. Of course, we need to have essential amino acids and the protein because they build the body. And there's the discussion which is happening on how do you prevent and how do you decrease your calories and also the oil consumption. With respect to the 30% of the oil, again, there are two components in that, and one is the visible oil, and another one is invisible oil. Invisible oil is something, when we take a milk, there is an oil in that. There's a fat component in that. That's invisible oil, and the visible oil is what we use. That oil, the oil,
cooking oil which we use, or ghee or butter.
There is a problem there because I think our consumption of the cooking oil and the visible oil is very high in our country, and it is rightly said that we need to restrict that and cut down on that so that we reduce our calories and the bad fats and obesity and those lifestyle diseases which
and also reduce import dependence because we are importing most of the edible oil.
Yes, in that again, of the 30% of the oils, the invisible oil, the omega-3 is something which is important, and I think we need to look into that. The easiest way I tell to the people is that, take a handful of nuts, 30 grams of nuts. It could be flax seed, it could be walnuts, it could be almonds, it could be any of the pistachios, anything. All these are something which will have a healthy nuts and the healthy component of the omega-3, which is important.
So, Bill, is obesity a bigger problem or malnutrition a bigger problem, or together for 1.4, 1.5 billion people, we have a serious problem? What do you think as the director of AIIMS?
I think we have to tackle both. We need to tackle both because somebody is eating more and somebody is eating less. So somebody is eating less, then we need to tell what is a balanced diet so that they will have a component of especially the protein, that's something which is very important. On the other side, then the people are not doing exercises, they are taking more calories, and a significant problem of this is through the oils, the fats, and that's something which needs to be restricted, so that you take adequate balanced diet and adequate number of calories, and the percentage which I said, the fat should not be constituting more than 20, ideally 25, maximum of 30. In that, have those good oils which are there, and today the discussion is happening on the various kind of oils. Somebody can afford, fine, cold press oil is definitely better. And what is important is, if you ask me, what is that we have to tell to the common man? Common man is the 2 to 3 or 3 to 4 teaspoons of oil, and that's the thing which we can have, nothing more than that. That is something which will come up to our visible oil for 15% of the component of the fats for the body.
At the All India Institute of Medical Sciences in New Delhi, Pallav Bagla for NDTV.